team, I am here with Leslie, and as promised, we are going to do a little tutorial on the AED. The AED. This is one of those things where we hope we never have to use it, but it's so much better to have the information, as you call it, like the insurance policy, that we have it and we know how to use it, and we feel comfortable using it. So we have practice pads that we're going to use today to show you how to use the one that we have here in the studio, and I'm going to let the expert take it away. By the way, this is our person. This is our spice person. Hopefully that is never a spice person, but anyway, so we've got a dummy.
All right, so the AED, if you don't know where it is in the studio, it hangs beside the front desk, kind of above the trash and the recycle, on its own little hook. It's right outside Studio 2. If you're not sure, it's a bright red bag and it hangs on the wall, okay? So if you need it, the most important thing to do first is to, you as the instructor, if somebody needs the AED, their heart is stopped, most likely, or it's not beating effectively. So you need to start CPR, that's step one. Step two is tell somebody else to go get it, okay? So a class participant, tell the front desk staff what's going on, yell. We all have big voices, we can yell, and have somebody else go and get it while you start compressions on the chest. This is, like Nicole said, something we don't ever want to have to do, but you need to know how to do it if you need it. So once you have it, you open it up.
While you open that up, Leslie, would you also say that that would be the same time to have someone call 911?
Absolutely.
So have somebody, if you have enough people in there, have somebody like say, hey, call 911, somebody go get AED, and at that point, you as the instructor start the CPR.
Yes.
Okay, go ahead.
So open it up. I would un-Velcro it because you can sort of hear it. It's Velcroed in the case. And turn it on. Okay, I won't turn it on because it's pretty loud, so turn it on first. That's step one. You will need to cut the person's clothing off. So we're all friends here. We always joke about, you know, nudity and all that stuff, but you gotta get them naked pretty much from the waist up. So use the trauma shears that are in the case to cut their clothing off, including the bra. You gotta expose everything so that the pads can go where they need to go. So once they are exposed, you're gonna pull where it says pull, and it's gonna start talking.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So you've done that, okay? Then what you'll do is pull this tab to pull the cover off.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
So that's what we did. So these are real pads. We're not gonna take the backing off because...
Look carefully at the pictures on the white adhesive pads.
I'll show them.
Peel one pad from the yellow plastic liner.
So this one is the yellow. I'm not gonna peel it, but it shows you exactly where you're gonna place it.
Pictures on the white adhesive pads.
And then this one
Peel
shows you.
one pad from the yellow plastic liner.
So you'll look there to see where to stick the pads. So there we go.
All right, so for the rest of...
Look carefully at the pictures on the white
I'm gonna just turn it off so it doesn't keep talking over us. And then what I'm probably gonna do is just disconnect this so we can take these out and actually use them to stick.
Okay. While she does that, if you guys ever want to take a look at this without going through it, inside the AED, there's a really great book, and it's basically step by step of what Leslie and I are doing right now. So she's gonna go ahead and place the pads here, and we'll go from there.
So the pads are labeled like Nicole showed you with which one goes where. So we'll start with the one that goes on the patient's upper right chest. So you'll peel it off. This is disconnected from the AED, so it's not gonna surprise anybody. So you'll peel it off. This is the patient's upper right chest. I'm not gonna stick it down too hard. This one comes off, goes under the patient's ribs on their left side. Okay, so under the patient's ribs on their left side. After that, and the whole time this is happening, somebody's on the chest doing CPR. That's the important thing to remember too. Nobody has stopped.
Not there.
You are still pumping that chest. Okay, once those go on, then the AED is probably gonna say, analyzing the rhythm. Everybody stops touching the patient at that point so that this guy can decide what needs to happen. Is there shock advised? Is there no shock advised? The AED will decide on that, and that's why it's automated. right? The A in AED stands for automated. So it's going to decide if it needs to shock. If it says no shock advised, you're right back on the chest pumping away, okay? And by this point, honestly, we are so close to the rescue squad. They should be here. They should be taking over. Advanced life support should be here. They should be taking it over from you at that point. But if they're not, you're pumping away, okay? So that's how we do this. If a shock is advised, it's going to say shock advised, and this lightning bolt button right here, the orange button, is gonna light up, and it's probably gonna be really, really, really loud, okay? At that point, everybody backs up. Nobody is touching the patient. Nobody is like touching their arm or their skin on any front. Everybody backs up. You need to have everybody's hands up in the air like you're getting held up out of bank robbery. So nobody is touching the patient. Then you push the shock button. The shock is delivered. There is no delay. You go right back to CPR. That is one of those things that has changed through the years. At one point it was immediate pulse check. At one point it was wait and see if they wake up. But now the guidance is immediate shock and immediately you're back on CPR, because so many times if a heart is then put back into a correct rhythm, it's just not strong enough to move the blood like it should. So yeah, you have a normal sinus rhythm, which is how our heart should beat, but it's not strong enough to be moving the blood like it should, so you're not perfusing anything very well, so that's why we go straight back to the chest, okay?
You guys, it's nice too, like if we turn it back on and push the blue button, it says to get help with CPR. So I know that as instructors, we are all certified in CPR, but it is one of those things, not to say like if you don't use it, you'll lose it, but like in that moment of like pure, I have to start doing this, your body has to go into that quick like reaction of what do I do again? You hit a little panic. So I always say like, I don't always say this because I've never actually, knock on wood, had to do it. But in my mind, I think like that's when you need to do the biggest exhale.
Yeah.
Like, calm yourself. You know what to do. And if you are in that little bit of panic mode, we hit the blue button. And let's see what it does.
In case of emergency, press the green on-off button.
All right.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
You have to have these where they're supposed to
Look carefully at the pictures on the white adhesive pads. Peel
It's
one
starting
pad
over again.
from the yellow place pad exactly as shown in the picture. Press firmly to patient's bare skin.
It may not do it because we don't have a real
When the first
person.
pad is in place,
So it won't
look
do it
carefully at the picture on the second pad. Peel
because it's not plugged into a real person and analyzing. It won't give you the CPR, but it does have where you can push the blue button and it basically goes through again what you need to do, the 30 compressions and getting your arm straight. It'll guide you through that as well. So let's see. You know, something that you talked about with modesty and like getting the clothes off and everything. One thing that I would also suggest is if we have clients there, ask them to leave the room. Like just go ahead and say, hey, if you guys, everybody out of the room, just keep 2 or 3 people inside that space. Give the person privacy, because sometimes other people's reactions will cause some extra stress that's not needed. So I would say clear the room and just have.
And if you have another instructor in class, keep them.
Yeah.
Right? Like if I'm in your class, keep me. And because if you get tired from CPR, you and I can keep switching off. You know, and especially having another trained person in the room that has gone through CPR training and knows how to help you with this, that's going to be more beneficial than trying to explain it to somebody who's never gone through this. Or if you have a nurse in your class, or a doctor, or a paramedic, because I know we have all of those people that come to this facility, right?
Yeah.
Keep them in your class. And most likely they'll volunteer to stay.
Yeah. So this is again, thank you guys for taking time to look over this video. Like we said, this is our little Spice insurance policy. I'm grateful that Leslie gave us the time to come in and go over this. If you have any questions, don't hesitate to reach out to Leslie, myself. Take a look at the AED, take it off of the wall, unzip it, look at it, flip through the book if you want to, and just know that we appreciate all of you guys taking the time to do this. That's it. Okay?
That's it.
All right, thanks.